Okay, we're gonna do patient assessment medical. So I'm gonna start my scene size up, my BSI is on. I'm looking for scene safety. It looks safe. If it's not, I will make it safe. My nature of illness is a chest pain response. I'm gonna call for additional help, and because this is a medical and I don't suspect that he's fallen, I'm going to, I considered C-spine. So now I'm looking at my patient, and my general impression is fairly okay. Looks like he's having some chest pain. How you doing?
Doing all right.
Good. So his level of consciousness, he's alert. I am looking at his airway is open and clear because he was able to speak to me. I'm looking at his breathing rate. It looks fairly rapid. He looks like he's getting some good breaths in though. So I'm checking for a pulse rate as well. He's got a good strong radial regular rate. So I'm gonna apply some oxygen. We're gonna go ahead and apply a non-nasal cannula, make sure his SpO2 stays above 94. So we're gonna get that applied. So skin signs, he looks a little pale, a little diaphoretic, but he looks warm, he's not cold. I don't see any external hemorrhaging at all. Since he's breathing still a little bit hard, I'm gonna assess his breath sounds real quick. How you feeling?
All right. Could be better.
What seems to be the problem today?
I just have this funny feeling in my chest.
Okay,
It
what does it feel like?
feels like something's sitting on me.
Okay. Like a pressure? Okay.
It's hard to breathe.
How long has that been going on?
Maybe the last 20, 30 minutes.
Okay. So what were you doing when it started?
I just finished mowing the lawn.
Yeah?
And I just felt tired, and then it just hit me.
Okay. Do you have any nitroglycerin or anything around?
I think
Have
so.
you ever been prescribed that?
Yeah, about a couple of years ago,
Okay.
my doctor told me I needed that.
Okay, well, I'm gonna have my partner try to go find it. Is it in your...
I think it's in my
Gotcha.
medicine cabinet.
Okay. All right. So his airway's open, clear, breathing looks a little bit labored, but has got some oxygen on him. SpO2 above 94%. His radial pulse is good. So we're just going to continue on with our OPQRST. I know that I need to eventually get him moving in the ambulance, so I'm going to have someone go out and get the stretcher for me. Is that oxygen helping your breathing at all? A little bit?
Yeah.
Okay. Are you nauseous?
Not so much.
Okay, did you break out in this sweat, or is that from mowing the lawn?
It happened after
Okay.
I stopped mowing the lawn.
All right, does anything make it better or worse, this pressure?
Sitting down, hunched over like this.
Starting to help?
Yeah.
Okay. So is it going anywhere, in your jaw, your back, your arm? You got pain anywhere else?
Kind of in my shoulder, right here in my back.
Okay. And on a scale of 0 to 10, 10 being the worst pain you can even imagine, what do you think this is, this pressure?
Maybe like a 6.
A 6?
6 or 7.
Did it start at a 6 or a 7? Has it been steady?
Yeah.
Okay.
It's been steady.
All right. So I'm going to press on your chest. Will you tell me if it hurts? Does it hurt when I press?
It's a little sore.
Little
but
sore?
It doesn't hurt.
Okay, does it hurt over here?
Mm-mm.
How about your abdomen?
Mm-mm.
No pain there?
Mm-mm.
Okay. I'm looking for jugular venous distension. I'm going to look for pedal edema as well. I already listened to lung sounds. How is that oxygen? Is it kind of helping you?
A little bit, yeah.
Okay. Well, I'm going to get a set of vitals real quickly and see if I can give you some of this nitro. We're going to give you 324 milligrams of aspirin. Are you allergic to anything?
No.
Okay. So I'm going to have my partner get that out. I'm not going to have him give it to him quite yet. I'm going to take your blood pressure. What kind of medical issues do you have?
I was told I might have angina a couple of years ago by
Okay.
my doctor.
How about high blood pressure?
High normal, yeah.
Okay, you take medicine for that?
I do.
Have you ever been stented in a cardiac lab?
No.
Okay. All right, so I'm just going to check your blood pressure. If you can just breathe normal. 44/80. Now I'm gonna check your pulse rate. I'm gonna get an SpO2 on you as well, make sure they match up, pulse rates. Okay. I'm at 86 for a pulse rate and 16 for respiratory rate. So I'm going to ask you a few more questions. So what medicines do you take? And I'm going to have my partner write these down. You said nitro.
Mm-hmm.
Do you take aspirin on a daily basis?
No, not
Any,
usually, no.
any blood thinners or
No, not that I can
Plavix or
think
anything
of,
like
so,
that?
not that I remember.
you haven't? So you are being treated for hypertension, for high blood pressure, right?
Mm-hmm.
Okay.
Yeah, I'm not sure what I'm taking.
Okay, we'll find those.
Okay.
Any other medicine for respiratory issues, diabetes?
No.
Okay. And you're not allergic to anything. When was the last time you ate?
This morning, like 3 hours ago.
Okay. And you were more on the lawn when this came. So we're going to go ahead and give you these little baby aspirin. There's 4 of them. I need you to chew them up, okay? So
Okay.
we'll give that to you. And then I'm going to call medical control and ask for permission to give you some nitroglycerin, okay?
Okay.
Well, how old are you?
I'm 23.
Okay. So medical control, this is Medic 44. We are on scene of a 24-year-old male patient that began to have a sudden onset of left chest pain. It looks like it's pretty centered around his sternal left side area. It started 30 minutes ago after he got done mowing the lawn. Nothing makes it better or worse, or kind of sitting down makes it better. It's a 7 out of a 10 pain. He's got some radiation into his left shoulder. His vitals right now are 144/80. Pulse rate is 84 in regular, or 86 in regular. Respirations and his SpO2 respirations are 16. SpO2 is 95%. We got him on 2 liters of oxygen. I'm going to request permission to give some nitro, 1 sublingual spray, if that's okay. So they tell me it's okay. Okay, 1 spray of nitroglycerin sublingual we're going to give. So what we're going to do is we're going to have you lift your tongue up, and I'm going to spray this nitro underneath your tongue, okay?
Okay.
This is supposed to help your chest pain, so I'm going to... So you ready? 1, 2, 3. All right, we've got the nitro on board. We're going to note the time. It might give you a headache. That's fairly normal. Hopefully it won't make you nauseous. But we're going to load you onto our stretcher at this time and get you going to the hospital. Is that okay?
Mm-hmm.
We're going to meet a paramedic unit en route. They have a life pack, or they have a monitor so that we can check out your heart a little better than all this. So we're going to head that way. So we're en route doing our thing, and we'll rendezvous and we'll reassess vitals, our interventions, and our primary assessment, LOC, ABCs, our interventions, and our vitals every 5 minutes. And we'll hopefully get that pain down to a 0. Okay. That was horrible.
That wasn't bad.